Okay, Kathy.
We're live.
Good morning and welcome board and online viewers to the June 3rd, 2026 Board of Health meeting. The board meeting is officially called to order at 8 a.m. This virtual meeting is being streamed via YouTube and the link will be shared at the same time through Facebook if you want to join us. The May minutes were distributed to the board for the review prior to the meeting. Please remember that in compliance to the Open Meeting Act and guidelines, every voting person or member must be seen and heard. Are there any discussions or amendments to the minutes?
I move adoption.
Not, thank you, Ms. Margolis. May I have a second?
Second.
Reddick seconds.
Thank you. All in favor, please raise your hand and say aye.
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 Any opposed? Please raise your hand. Any abstentions? And if not, motion approved as distributed. Thank you very much, everybody. We are in June. It's hard to believe we're starting the last month for the first half of this year, and the time has gone by so fast. For June's observances, we have LGBTQ plus Pride Month, that it's honored throughout the month to celebrate LGBTQ plus identity, equality, and community. Also, National Flag Day on June 14, it commemorates the adoption of the first official U.S. flag by the Second Continental Congress in 1777. We also have Juneteenth on June 19, known as Freedom Day, marks the end of slavery in the United States and the strength of the African American heritage. We also will celebrate Father's Day, June 21st, in so many countries, not just in the US, and we will celebrate fathers and father figures everywhere. And of course, Public Service Day, recognizing the hard work for all the work of public workers. Thank you so much. Our perspective session for this month is Louisville Metro Air Pollution Control District work and its impact on the county's public health. The presenters are Ms. Rachel Hamilton Squire, the director, and Flannery O'Neill, assistant director. Ms. Rachel Hamilton Squire is the director of Louisville Metro Air Pollution Control District, an environmental regulator for more than 30 years. She holds a BA in biology from Salem College and a JD from the University of Louisville. And again, go Cards. Brandeis School of Law. Since 2009, she has been privileged to work with the APCD. She's a dedicated group of air pollution control professionals who continue the agency's more than 80 years of work improving Louisville's air quality. Thank you. She has worked for the Florida Department of Health, the Florida Department of Environmental Protection, and the Indiana Department of Health. Ms. Flannery O'Neill, MPH, she's the Assistant Director for LMAPCD. Flannery was born and raised in Louisville, a proud Louisvillian. After finishing high school, she attended the American University in Washington, D.C., where she completed a BA in International Relations and minor in Spanish. After graduating, she spent 9 years in Phoenix, Arizona, where she worked in healthcare and public health roles and completed her master's in public health with AT. In 2014, she moved to Southern Colorado for a leadership role in local public health agency. So prior to joining the APCD in March, she worked in remote leadership roles for two nonprofits focused on non-communicable diseases. She moved back to the area in 2021 with her husband and her dog, and it's excited to be part of the team. The teams in Louisville and across Kentucky that are working to improve the air quality for our communities. Today I present to you Ms. Hamilton Squire and Ms. O'Neill. Welcome to both, and if you have a presentation that you would like to share, you may do so at this time. It's 20 minutes for presentation, and then we'll have a discussion. I yield the floor to you. Thank you.
Thank you very much for having us this morning. Flannery and I are both very glad to be here. Our work at its core is public health. I've framed my presentation this morning more on how the district works and where we are with respect to our air quality journey. I am happy to answer any questions about the public health impacts as we move forward, but I didn't include the slides about many of the types of public health effects that poor air quality can bring. That is not the correct slide deck. One moment, please. You go
Thank you. No worries.
Your email.
In my email. That one. That's the right one. Thank you. All right, ready to go. So as your chair mentioned this morning, APCD has been here in some form or fashion for almost 80 years. And the picture that you see represented there is actually a daytime picture of downtown Louisville. We burned coal everywhere, in small power plants along the river, in people's homes, and of course in factories. We started as something called the Louisville Smoke Commission. At that time, we actually measured air pollution with buckets hung on light poles and with rulers. The technology for air pollution has changed very much over time, but this is a good representation. Next slide, please. Air pollution really became a central focus from a public health standpoint following the London killer fog and the Denora, Pennsylvania event in 1952. The Commonwealth took a lead in adopting KRS Chapter 77, and with that, it provides every county in the Commonwealth, all 120, with an opportunity to stand up and operate an air pollution control district. The key term that you need is to find your area so polluted and make a demonstration that you have the fiscal, administrative, and technical wherewithal to run that district. And since 1952, we have been the first and only within the Commonwealth. Next slide. We preceded the Federal Clean Air Act by many years. I know everyone's real familiar with that 1970 Clean Air Act that was signed into law, but there are actually two other Clean Air Acts. There was the first 1956-57 study that was ordered to see what was in our air, then a 1960s evaluation of that data to determine what does it mean with respect to public health. That's what gave rise to this 1970 Act that we're looking at now. In it, Congress set up a miraculous, to me, continuous improvement plan. EPA is charged with setting national ambient air quality standards. State and local governments, as you see highlighted there, are responsible for managing air pollution at its source. That's a really neat way of kind of splitting the responsibilities. We do that through something called cooperative federalism. Next slide, please. With the development of the Clean Air Act, states were then required to establish environmental cabinets. Here in Kentucky and the other 119 counties, our counterparts at the Kentucky Division for Air Quality, implement the federal program. That's delegated to them. We have a separate delegation direct from US EPA here at the district. Ours is not derivative. It doesn't come through the state. That's different than, say, North Carolina or Florida, where the state has an overall oversight role over those local departments. It's different here in Kentucky. One of the more important distinctions to keep in mind is that when the General Assembly established the cabinet, they limited the cabinet's work to being no more stringent than federal law. Federal law is their floor. However, because of the brilliant move they made to allow an area that finds itself more polluted or in need of more control to stand up a local air pollution control district, they have allowed those districts to be more stringent. And so for us here at APCD, the state and federal law, which is the same, is the floor, but not the ceiling for us. We can be more stringent, and I'll give two good examples of where our programs have done that recently. Next slide, please. This is a great graphic for thinking about how we do our work here at the district. We monitor the air to see whether or not we're meeting those national ambient air quality standards, which EPA sets, and then is required to review on about a 5-year basis, and to strengthen those standards when they need to be stronger to protect public health and the environment. We do regulatory policy and voluntary program development so we can plan to meet those standards. The district issues permits, we verify compliance, take enforcement where necessary, and every day, in almost a continuous way, we monitor the air to check that work. Next slide, please. This is the district's org chart. It is set up to represent that cloud. You'll see air monitoring, industrial permitting, compliance and enforcement, and of course, our program planning section. And we are represented by a crew of very good professional administrative folks who help us keep the lights on and make it possible for us to do our work. You'll note that the Air Pollution Control Board is there in the upper corner. They are our regulatory authority. The district itself is a subdivision of the Commonwealth. We are much like MSD in that respect in terms of our authority and our ability to do our work. However, through the city-county compact and then merger, we're administratively connected to Louisville Metro government. The way I like to describe that relationship is they're our hiring, firing, and funding partner. For funding, we receive a small amount from the general fund. We receive grants from US EPA. One's a general grant to do day-to-day work. The other is specifically for monitoring particulate matter. And then, of course, we have program permit and emissions fees that we charge the more than 600 companies that we regulate here in Jefferson County. Next slide. These are the locations of our air monitoring stations. We operate a wide suite of instrumentation. Our air monitoring network plan, not just for Jefferson County, but for the whole Commonwealth, is currently open for public comment on our website. If you're interested in learning more about that, that report is quite comprehensive, and it shows how the data we collect meets the federal requirements, and then how we demonstrate the validity of that data to be sure that it's good for demonstrating attainment and regulating sources here in Louisville, transportation planning, and even the research that many of folks on the call who work at the University of Louisville do. Next slide. We also have 2 stations here in town where we are running field deployable auto gas chromatographs. This is relatively new field technology. One is in Rubbertown, where we're looking at a set of chemicals for air toxic impacts. The second is at Cannons Lane, where we're looking at many of those same chemicals for their potential to form ozone. So it's the photochemical reactivity of the chemicals that we're looking at there at that Cannons Lane site. Next slide, please. You can always find information about air monitoring at Louisville Air Watch. That's in near real time. It will give you an air quality index view of air quality. And then each month we update our board with specific data so that they are in the know about where our trends are going. Next slide. Our permits tend to be very specific, as you could imagine. There's shelves of federal rules that apply to companies that we regulate, like Louisville Gas and Electric, and American Synthetic Rubber Company, Ford Motor Company. These are large permits. They go through not only the standards that apply to the company, but the record keeping, reporting, monitoring, and testing necessary to assure compliance. Next slide. Our compliance insurance group covers a whole different set of things in terms of inspecting those plants and facilities that we regulate, But we also have staff who investigate community issues like odors and dust. And we have next slide, a small business environmental compliance program. This is a required element under the Federal Clean Air Act's Title V program. Oftentimes we do find that companies are very good at the work they do, such as painting cars, but they may not be so good at keeping records or doing the math that is necessary to demonstrate compliance. And we do have a small business program to assist them. Next slide. Our program planning section does everything from, in APCD air terms, everything from SIPs, that's a state implementation plan to demonstrate compliance with the National Ambient Air Quality Standard, to NUTS. We have teams that communicate with the public about local air quality, but we also have voluntary programs where we incentivize people to take steps that they can do to reduce pollution right at the neighborhood level. Next slide, please. Our Air Pollution Control Board is our regulatory board. They, not Metro Council, develop the rules and regulations that guide our work here at APCD. They also approve agreed board orders over a certain amount with companies that have a violation. And then they have an adjudicatory role in challenges to final determinations made by the district. So the district issues permits. If that permit is challenged, it'll go through an administrative hearing process. The administrative hearing judge will make a recommendation, and the board may or may not accept that. Our board currently has 7 members. You can find information about them on our website. We try to get a wide variety of people from the community to be on our board. Currently, Steve Sullivan, our chair, is a retired professional geologist. Dr. Jeffrey Coburn is now a retired JB Speed School environmental engineering professor. Candace Shobe White is a data analyst here in town. Marissa Neal has worked in state government as a consultant. Charlie Bertram is a retired engineer. Dr. William Porter is a pulmonologist, and Robert Blair is a nurse. Next slide, please. This is really where that public health-based part of our work shows up. When EPA was established back in 1970 with the Clean Air Act, then Congress asked them to focus on criteria pollutants. And there are these 6 pollutants here: carbon monoxide, lead, nitrogen dioxide, particulate matter, ozone, and sulfur dioxide. When the Clean Air was passed, Louisville was not meeting the carbon monoxide standard in the ambient air. I find that stunning at this stage of life, but it took many years to bring the area into attainment with that standard. And the primary source of that was from vehicles. With respect to lead, we no longer monitor for lead here in Louisville, since lead has been removed from gasoline and paints. We do not have a lead source here in town. To remove the lead monitoring requirement from our work, we had to go through a pretty comprehensive monitoring study, present that to EPA, go through public notice and comment, and to date, we've not had any other lead sources come into our area. Nitrogen dioxide has both health impacts by itself, but it is also a precursor for the formation of ozone, which is not directly emitted from a source, unlike these other pollutants. However, nitrogen dioxide combines with volatile organic compounds in the presence of sunlight during the summer months here, and we form a new pollutant called ozone. We're currently meeting all but one of the National Ambient Air Quality Standards. Sulfur dioxide was a challenge here back in 2011 when the new standard was strengthened to 75 parts per billion. Our area's attainment status, we were at 149 parts per billion. That is twice the standard. But through 2 projects at LG&E, one to convert Cane Run from coal to natural gas, the other to install additional controls at Mill Creek, as well as to add on scrubbers at 2 of their 4 units, We've brought the area down into attainment for that standard, and we're typically seeing about 20 parts per billion of sulfur dioxide. And that's really important because in and of itself, it's a pollutant of concern. It causes health impacts on inhalation, but it also has the unfortunate side effect of creating particulate matter too. For particulate matter and for ozone, we'll do a little deeper dive. Next slide. When I talk about the Clean Air Act being a continuous improvement plan, what you see on the screen represented by those colored blocks is when EPA has evaluated the current standard and determined that a lower standard is necessary to protect public health and the environment. And so you see blue from 1999 to 2012, green from 2012 until 2023, and then yellow moving forward from 2024. We are currently meeting the National Ambient Air Quality Standard that was strengthened in 2024 from 12 micrograms per cubic meter to 9. It's a 25% reduction, and it is a meaningful change. The World Health Organization hopes to have a worldwide 10 microgram per cubic meter standard by 2030. And again, our area is meeting the current 9 microgram per cubic meter standard. I do want to ask you for some help on this. This is a place where we may need for your advocacy as things change with US EPA. The 2024 standard was passed under the Biden administration. The Trump administration has indicated that they will be reviewing this standard. That typically means that they would go through with the Clean Air Science Advisory Committee and the Science Advisory Board and evaluate the most up-to-date science and then make a recommendation to change that standard. That's what they told us they would do when they came into office in 2025. However, a lawsuit had previously been filed in 2024 by the Kentucky Attorney General, challenging that new 9 microgram per cubic meter standard. EPA defended that case for a year, and then in November of last year came into the court and told the court that they had made an error in defending the case and that they agreed with the plaintiffs that the error was accurate. To date, the judge has not acted on this. We're not really sure what the next steps will be here. It's one to stay tuned on. We update our board on this every month as anything happens, because we think that this is an important metric to maintain. We believe here locally that with our planning and work with LG&E, one of the primary sources of particulate matter pollution here in the area, that we should maintain 9 microgram per cubic meter standards, and that it's possible for us to do that. We do see some impact, as you may remember, from Canadian wildfires. We saw effects here locally in 2023 and 2024. So this is just one to stay tuned on. If and when we do see more formal action to roll this standard back, we will reach out to Connie as a contact to see if your board is interested in providing comments to either US EPA or others about how important the 9 microgram per cubic meter standard is. In terms of communicating the public health consequences of air quality, we use the Air Quality Index. It's a color-coded way of presenting information important to people. You may receive an air quality alert. You may see it on a Trimark sign. We forecast poor air quality so folks can take care of their health. When it's green, we are at half of the standard. When it's yellow, we're at the standard. Orange is unhealthy for sensitive groups. Red is unhealthy. I don't ever want to see purple or maroon, but it gets worse from there. What you see in this trend line from 2000 is that our good air quality days have increased. And we've had few, although you do see some in 2021 and 2023, days where we've been unhealthy for sensitive groups. Next slide, please. Ozone's a little bit more tricky. Again, you see where EPA has revised those standards to protect public health and the environment. And the trend line is not as straight or as pronounced as I'd like it to be. With respect to our area, we have attained the 2015 8-hour ozone national ambient air quality standard of 70 parts per billion. We submitted paperwork to EPA making that demonstration back in 2022. They proposed it for approval in 2023, and then Canada caught on fire. And we are in a policy situation with EPA where they won't approve it until you are able to show that those violations were caused by those fires. We've successfully done that for 2023. The technical requirements to show that fires 1,200 miles away, or some of the other ones in Western Canada are over 2,000 miles away, made ozone here in Louisville, Kentucky. Was a bit of a challenge. We were the first in the nation to do that. And we will be submitting another exceptional event demonstration for 2024 here in a few weeks. It'll go out for public comment for 30 days, and perhaps you'll have a chance to review it at that time. We think we'll be able to bring our area into attainment with that demonstration. And that's important because when we're in non-attainment, it has an effect on economic development. Clean air is important for economic development, and the Clean Air Act is intended to allow for continued growth in an area by requiring companies to do more when an area is not meeting the standard. And so we believe that our program is a good, solid program, and we'll be able to demonstrate attainment here shortly. Next slide.
You have 2 minutes to finish.
Thank you. Air quality index trends up for ozone is very positive. Next slide. 2 places where I want to highlight where we go beyond the federal program is our Strategic Toxic Air Reduction Program, or STAR. This came out of the West Louisville Air Toxic Study that we did with U of L, U of L, Kentucky Division for Air Quality, US EPA, and the West Jefferson County Community Task Force. Next slide. It's one of the most protective in the nation. We've been able to drop the riskiest chemicals by almost 97%. The program evaluates on a daily basis emissions of cancer-causing chemicals, as well as the non-cancer effects those chemicals may have. Overall, all air toxic emissions have dropped 85% since 2005 when the program was adopted. Next slide. We also have a risk management plan program. This is a chemical accident prevention program that we previously implemented in coordination with the Emergency Management Agency to be boots on the ground for the district. We are not hazmat trained. We have since executed a memorandum of understanding with the health department to do this program together. We're really grateful for that partnership. Next slide. I'll leave you with this. Over the last 60 years of the Clean Air Act, we've seen a tremendous growth in gross domestic product. That's about 280% there. Vehicle miles traveled have increased. Our population has increased. Our energy consumption has dropped a bit. Our carbon dioxide emissions have also dropped, but the aggregate emission reductions of those criteria pollutants I mentioned have gone down about 80% in the last 60 years. So there is still work to be done, and plenty of good work is going on here in Louisville. And we look forward to the new things that we'll be working on in the future. So with that, any questions?
Thank you very much. Any questions or comments? I just want to, yes, go ahead.
This is Dr. Hedges. I just have one quick question. Can you give me some idea of how the Louisville metropolitan area fares compared to other cities of our comparable size in terms of air quality? How would you advertise us? So if you look across cities our size across the country.
Well, that's a really good question. And when you look at cities by size, what we have to do in our world is look at cities by sources. And so here in Louisville, we are the manufacturing base and economic driver for the Commonwealth. And the sources that we have here, coal-fired electric plants that are switching to natural gas, which is a good and big benefit for us. But also we have that synthetic chemical manufacturing complex on the Ohio River. We don't have to look far. We know how we have reduced pollution here in Louisville compared to other manufacturing areas within the Commonwealth. And those have been significant reductions. The ozone issue here is complicated by those Canadian wildfires. But the American Lung Association, who does a tremendous advocacy program in their State of the Air report, often ranks different. So let's just put that to the side. Information on that if you would like to hear that. But of the top 25 areas that the American Lung Association look at, their metric makes us equal to less. And that's equal in their work. Area is with the Canadian area is just that ozone standard. We'll meet that, will be in.
They got frozen. Let's a minute, a few seconds. This is a very important. Are you then? Okay. We will come back to finish with our presenters and to give thanks to their presentation. For now, we will continue our agenda and allow time and space for updates and from the mayor's office update. Now I yield the floor to Deputy Mayor Nicole George. Deputy Mayor.
Thank you, Chair. Just want to give a big shout out to the Health Department for all the work they have done. Activities and appreciate. Team is doing tremendous work. Mayor and the mayor's office certainly supports that. And I personally have had a new appreciation for the volume and intensity in which that occurs. So thank you guys. Please keep up the good work. And when APCD gets back on board, I'll have a comment to share as well.
Ms. Hamilton, are you ready to continue? Doesn't seem so. So we will continue.
Chair, my understanding is APCD has had a power outage, so that's why they're down.
Oh, okay. We will continue, and then if they are able to come back to the meeting, we'll allow them time to finish. Thank you so much, Deputy Mayor. We'll go to the director's update. Now I yield the floor to Louisville Metropolitan Health and Wellness Chief Health Strategist, Ms. Connie Mendel.
Good morning.
The floor is yours.
Good morning. Thank you. It's so good to see everyone. Everyone should have a copy of the director's report in their package. I'll just give a couple of quick highlights. It begins talking about the multi-state human trafficking operation. We were it was really good to see some work done in that area where some individuals were taken into custody. But want to share that this is part of an ongoing effort of this multi-agency task force. So it really strengthens the work between law enforcement, metro governments, ABC and the health department, and other traffickers, or I'm sorry, other partners within metro government to identify and take action against human trafficking. I just want to say, for everyone on this call and for others to share with others, that if you suspect an illicit business, whether it's massage or otherwise, if you suspect even a hint of human trafficking, please report it. That way we can take action. Human trafficking is a very concerning and increasing issue. So please keep your eyes open. And with so many areas, if this is something you see, please reach out. You can reach out to LMPD or directly to the health department, and we will take action and investigations. There's other information in the report referring to Kentucky Derby related activities. Our team is very active during this time, doing all we can to keep our residents and visitors safe, particularly from foodborne illness, but other issues. So just a big shout out to the team for that. There's also some information around our youth vape initiative. So this is youth-led, and this is working with teens to push back against vaping. Unfortunately, we continue to see an increase in vaping in our youth, even some as early as elementary school age. So, vaping has basically replaced smoking tobacco for our youth. So the program is Louder Than Smoke. Please, if you want to get involved and learn more, just visit thelouderthansmoke.com. Also, next thing on the item we talk about is our Gray Street Farmers Market. We love our farmers markets, and there's a lot of opportunity. Ours is moving, so there's location information in the report, but sharing great opportunities for our fresh RX and passport to produce. So this is free food for families with Medicaid. There's a double dollars program for people that receive SNAP, the Supplemental Nutrition Assistance, to double some of their money. And also there's the Senior Farmers Market Nutrition Program. So all great opportunities to get good nutrition out to our residents. Please share that information also. And then just real quickly, I wanted to give an update. There's a lot of communicable disease information in the news. I'm sure you're aware. We are, as a health department, monitoring for Ebola for anyone that is traveling back or returning from areas of concern. So that would be within the Congo and Uganda. So that's something that our communicable disease and disease investigators are working with anyone returning back. And we have had a few people return back into the Jefferson County area. None of them are considered high risk. But just being in that area alone adds them to a monitoring. So we're checking in with them regularly, and we'll continue to do so. We know that, we're excited that the U.S. is hosting some of the World Soccer Cup games, but so there's another opportunity for us to just stay vigilant, stay aware, and again, we'll be monitoring anyone returning from those areas. And then also, just note the hantavirus with related with the cruise ships, and that has also made the news a lot. So we're not at a risk or not a high risk. There's a very low risk really for anyone in the U.S. as far as the spread of hantavirus, but letting you know that we are an alert. Between Ebola and hantavirus, we're speaking regularly with the healthcare systems, with our medical providers, including EMS and others, just so that we know what to look for, how we're communicating, and just making sure everyone is prepared as possible. So just sharing that information. Thank you. And I will pass it back to you, Chair.
Thank you very much. Thank you for those last words on the communicable diseases. And for family health centers, our presenter, Ms. Hamilton, hasn't come back yet, so we will continue. For family health centers, now I yield the floor and welcome once more the new Family Health Center CEO, Mr. Sam Riddick. Mr. Riddick,
Thank you
I
so
yield the
much.
floor to you. Mhm.
Thank you so much, Chair. So I'm going to share my screen real quick and provide a quick, very brief presentation for which to share with the board. So again, I just want to take a quick moment to introduce myself. I'm Samuel Riddick. I'm the Chief Executive Officer, excuse me, a Creature of Habit. I've served as CFO at Family Health Centers for the past 12 years, but with Bart's retirement effective May 31st, I've now transitioned to CEO effective June 1st, so effectively my second day on the job. And I do want to say that I'm very glad to be with everyone today. And what I'd like to do is just provide you with a brief update and a few slides this morning covering kind of where we stand with respects to Medicaid enrollment in our community, the exciting work that we're doing to expand school-based care at Pleasure Ridge Park High School, and how we're reaching families this summer through our various pop-up clinic initiatives. Next screen. This is an overview of Medicaid enrollment and the corresponding coverage declines that we've seen. And just to provide a little bit of context, when the federal continuous enrollment protections ended in April 2023, Jefferson County became a precipitous 3-year decline in Medicaid coverage. Adults were hit first, right? Then children followed when the recertifications began in June 2025. And unfortunately, that decline is still accelerating. Today, only about 128,000 adults and about a little shy of 98,000 children remain enrolled, and that represents thousands of residents in our community have lost coverage since the unwinding began. Over the past year, coverage losses have continued, and this is a real impact to families that we serve. Those without insurance will often delay care or defer care, which obviously can have long-term effects and increase cost for medical care and the economics of our community over time. And from our perspective, what makes this especially troubling is that the vast majority of disenrollments for children are procedural. In other words, they're not eligibility based. It could be a missed notice, a change of address, a form not returned in time, and a family loses coverage, right? But they do still qualify for Medicaid. So we have a real rich and robust outreach and enrollment team led by Ashley Shoemaker, who is with us today. And they're on the front lines, right? They're helping families get re-enrolled and stay covered. And our summer pop-up clinics extend that work directly into our community. Next slide. I would like to talk a little bit about our expansion in school-based health at PRP. We believe our school-based clinics and healthcare options is one of the most powerful tools for reaching vulnerable children and families, meeting them where they are, right? Removing barriers to care and transportation issues, providing care regardless of coverage, right? Our Iroquois High School proves that it works, right? In 2025 alone, we saw about 3,300 visits. And PRP, we believe, is the natural next step, right? Bringing that same level of access and care and continuity to thousands more students and their families and community members in the fall, opening in August in 2026, 2027. We do have an MOU with Jefferson County Public School System. That agreement runs through June of 2028. Hiring and procurement is currently underway, and the clinic will serve students, staff, and their family from day one, regardless of insurance. For care not offered at the actual site clinic, students and staff are referred to our fixed clinics for various primary care or specialty needs or for any sort of pharmaceutical needs they may have. Next slide. Actually, that is the last slide that I'm going to offer today. So I'll yield the floor back to Chair for questions, comments, any issues that others may have.
And if not, we will continue with Ms. Ashley Shoemaker to continue on the Medicaid and health coverage. Ms. Shoemaker, I yield the floor to you. And after her, we will go back to our discussion with Ms. Hamilton and Ms. O'Neill. Ms. Shoemaker.
Yes, so as Mr. Riddick alluded to, with child renewals, we have been seeing children continue to lose coverage for procedural reasons. The post-COVID public health emergency child renewals, that batch of children who had gone now, almost 6 years without needing to complete a renewal. That process will be winding up next month. So we're hoping that into the next quarter we will start to see those enrollment numbers for children begin to stabilize, as all of those children who had not had to complete a renewal for several years, they will have gone through that process now. So that does end in July. So hopefully, going forward, we will start to see that number stabilize. That's my expectation. But we are monitoring that closely. One other important thing I wanted to mention was that CMS issued the interim final rule on the Medicaid work requirements on Monday. So that is the guidance that states have been waiting for in order to finalize their plans for the Medicaid work requirements. I am reviewing the document. It is almost 400 pages long, so I'm chipping away at it. It's some fun, evening reading. But I hope to have some more information, on, the state's plan to implement these work requirements by our next meeting. It is open for public comment for anyone who wishes to make a public comment on the interim final rule. That is open through July 31st. And I will include the link to make the public comments in the meeting minutes. I'll send that to Arlana. Our next coalition meeting is scheduled for June 8th at 4 o'clock. Does anyone have any questions for me?
Ms. Shoemaker and Mr. Reddick, this is Dr. Shah. I had a quick question. I know we were talking about the actual work requirement, but I think there's part of this also requires some cost sharing on the patients and the copays, and then shortening the enrollment period into Medicaid. Do we anticipate that further impacting the numbers that we're seeing? And if so, are we doing something about that?
Yes, absolutely. So the Medicaid work requirement begins at the same time that the recertification process is going to be shortened. It's not for every Medicaid member, it's for our Medicaid expansion population, just like the work requirement is also for the Medicaid expansion population. But that begins on January 1st. So in addition to having to prove that you are working or otherwise meeting this community engagement for 80 hours per month, people will have to recertify every 6 months. And so every 6 months, they will have to be proving that they meet that requirement instead of just once a year. To make matters more complicated, families can have different statuses. So the adult in the family may be in the Medicaid expansion population, and they may have to recertify every 6 months. For children, they recertify once a year. For pregnant women, it's once a year. So you could have, households with multiple recertification periods throughout the year, more frequently than just, every 6 months. In addition to that, there will be some cost sharing requirement. The state in House Bill 2, they capped that at $5 for most services and $1 for prescriptions. Primary and preventative care and behavioral health services are excluded from those cost share requirements.
And just to add one additional item to what Ashley had just discussed, for patients that are presenting at FQHCs, there's a blanket exemption, so therefore they would have no cost sharing or co-insurance obligations if they have Medicaid.
That's good to know. And I think spreading that word might help FQHC's population, enrollment as well as folks knowing that, hey, don't go to the ED, don't go to urgent care. If you need care, please seek at FQHC so you're not on the hook for the money.
Agreed.
Thank you.
Or question?
Chair, I have just one question. Where are we seeing the most success with re-enrollments or recertifications for children?
In our clinics, it's really just sort of being reactive when families come in. That's usually when they find out that they don't have insurance, when they need to pick up their medication or come in for a provider's appointment. And so, our connectors are there to, assist people, the same day to help them get re-enrolled. And we do outreach in the community as well. We are at, in the summer, health fairs. We'll be at the Portland Fest this weekend, and trying to get out into the community in places where we know that families congregate, so we can educate them. But most of the success is when they come into the provider to have a medical visit, and that's when they found out that they're uninsured.
Okay, thank you for being at Portland Fest. Hopefully I see someone there.
Question or comment for Ms. Shoemaker? To finalize our discussions for questions or comments with the Louisville Metro Air Pollution Control District, Ms. Hamilton and Ms. O'Neill, do we have any comments or questions for them?
Chair, no questions. I just want to say, first of all, point of privilege, because Director Hamilton will be retiring at the end of this month. And I can't say enough about how much she has done for our city, both in the way of leadership, but also with real outcomes as it relates to improved air quality, ozone pollutants. I mean, I have come to fully appreciate all the progress we're making, and that doesn't happen overnight. So Rachel Hamilton will be missed. She cannot be replaced, although we're super fortunate to have Flannery there. All that to say, Director Hamilton, you are the definition of success, as demonstrated by your favorite poet, Ralph Waldo Emerson. Thank you.
Thank you. If you are interested in learning more about the American Lung Association's work and how it compares in Louisville, we presented that to our board, and there is a presentation on our website. I do invite you to look at that data. It's very important. But generally speaking, we're going to nip this ozone thing in the bud. And because we can be more stringent with air toxics, we at 2002 were the #1 dirtiest county out of 736 in the 8 Southeast states. Our most recent look at that data shows that we're 162nd. So that is a tremendous improvement for an economic driving area like ours.
Both and the whole team for the really impressive work that you are doing, keeping all of us, not just the economical growth, and economical growth is key for our city, but the health and the impact and public health, as you mentioned, for the whole community. And thank you, and happy retirement.
Thank you very much. We appreciate your all's partnership.
With our Immunizations Advocacy Committee, Dr. Wang said she doesn't have anything to share. For JCPS, I just want to share that JCPS is having immunization and physical clinics all this week. That's why they are not here with us today, but they are working towards, helping our student population. Thank you to JCPS. And for the Greater Louisville Medical Society, I want to welcome Dr. Chris Jones, the new elected Vice President and representative for GLMS for the Board of Health. Now I yield the floor to you, Dr. Jones.
I just want to say thank you to everybody. I'm following big shoes and my predecessor who was here before me. But what he did tell me is that he learned a lot from being on this committee and board. And I hope to do the same and bring back any information that we have to you all as well. So thank you. And I'm very delighted to be here.
And welcome once again. We don't have a representative from the Kentucky Nurses Association. So is there any old business that any board member or any community advisory member wants to bring to the floor? I want to remind you that next month we will vote to elect the next chair and vice chair for Louisville Metro Public Health and Wellness Board of Health. And for new businesses, does anybody have a new business for the meeting? For summer break, there won't be an August meeting, so I just want everybody to keep that in mind. Taking your time and your precious time to participate in this month's meeting. The next meeting will be held on Wednesday, July 1st, 2026 at 8 a.m. and this will be a virtual meeting. If there is no further business, we adjourn. Thank you very much. Have a beautiful day, a beautiful month. Enjoy. Thank you.